Dear students, today we are going to learn about medial. ഇന്ന് ഞാനിവിടെ ഈ വീഡിയോ ചെയ്യുമ്പോൾ I'm trying to avoid the video part of it. Audio മാത്രമേ ഉണ്ടാവുള്ളൂ. PPT നോക്കുക. കാരണം വെച്ചാൽ നെറ്റിന് പ്രശ്നമുള്ള കാരണം upload ചെയ്യാൻ it is taking too much of time. അതുകൊണ്ട് it will be better for you also without video. അപ്പോൾ PPT കാണുക, എന്നിട്ട് at the end of the session നമ്മൾ കൊടുത്തിരിക്കുന്ന പറയുന്ന ക്വസ്റ്റ്യൻസ് ആൻസർ ചെയ്യുക. എല്ലാ സബ്ജക്റ്റും പഠിക്കുക, അനാട്ടമി മാത്രമല്ല. At least make sure you learn about 3 long essays and about 5 short notes each from all the subjects. ഇപ്പോൾ കാണുന്ന അല്ലെങ്കിൽ ഇപ്പം ഓൺലൈനായിട്ട് വന്നുകൊണ്ടിരിക്കുന്ന ക്ലാസ്സുകൾ അന്നൊന്ന് തീർക്കാൻ മാക്സിമം ശ്രമിക്കുക. പിന്നെ ഇനി ലോക്ക്ഡൗൺ തുടരേണ്ടി വന്നാൽ ചിലപ്പോൾ നമ്മൾ ഇയർ എൻഡിങ് ഒക്കെ നമ്മൾ ചിലപ്പോൾ പ്രശ്നമായി മാറാൻ സാധ്യതയുണ്ട്. അതുകൊണ്ട് യു മേക്ക് ഷുവർ യു ആർ അപ് ടു ഡേറ്റ്. Medial is a cleft which is in the shape of a gun. You can see this diagram, how it looks. You can see how it looks. This part is the medial, and this is the eustachian tube which connected to the nasopharynx, and behind the medial in the mastoid, that is within the mastoid bone, we have this mastoid air cells and the mastoid antrum, and the medial is connected behind through an adductus. This tract which connects the medial with the antrum of the mastoid is called adductus to antrum. So the medial is supposed to be the middle portion of the gun, and it is usually air filled, and to keep the air pressure that of normal to the atmosphere, we have the eustachian tube which is connecting it to the nasopharynx. It is located within the temporal bone. It is located within the temporal bone between the tympanic membrane. This is the tympanic membrane, and the inner ear, which is called labyrinth of the inner ear. So medial cavity, this is a cavity, and outside we have the tympanic membrane towards the exterior, and towards the interior we have the internal ear, and it is shaped or explained like a 6-sided box, and it has got a roof which is formed by the tegment tympani, and the floor which is this is superior. Okay, this don't see this. Okay, what is explained in this I'll tell you later about this one. It has got a roof, a floor, the anterior wall, a posterior wall, medial wall, and lateral wall. The contents of the medial are following. It has got the ossicles, muscles, nerves, and vessels. This is the medial. You can see here. This is the tympanic membrane. That is the lateral aspect. This is the medial aspect, and we see a bulge here. This is called promontory, and this is the roof of the medial, and this is the floor of the medial. Here I'll just explain what is happening. On the lateral side, the tympanic membrane is there. Onto the tympanic membrane we can see this bone, which is the malleus. Malleus means hammer. It has got a handle, it has got a head, it has got processes It has got a lateral process, it has got an anterior process. This is the posterior part. You can see an opening. This is the adductus to antrum, and here you can see the incus. That is the body of the incus with which the head of the malleus is articulating. The malleus the handle of the malleus is almost embedded within the tympanic membrane. You can see there is a muscle which is attached here, and that is the tensor tympani muscle. Hope you remember, which I have told you when I was telling about the muscles supplied by mandibular nerve. And here you can see this is the handle, and here you can see one nerve which is going from posterior to anterior, and this is the caudate tympani nerve. And you can see here this is the body of the incus, which has got a short process and long process, and the long process is the one which is going to get articulated with the head of the stapes. The stapes has got one head, neck, two arms and a foot plate. Again, the malleus has got a head, it has got a neck, and it has got a handle, and it has got an anterior process and a lateral process. The incus has got a body, it has got a long process and a short process. Body will articulate with the head of the malleus, and the long process will articulate with the head of the stapes. And the stapes has got a head, neck and two crusts, and it has got a foot plate. It is called arms or crust, and it has got a foot plate, and this foot plate is the one which is going to seal an opening here, that is the oval window of the internal ear. So here in the roof you can see this is a facial nerve which is going from the roof of the internal ear, and then it is going to pass behind. It is going to pass behind the middle ear, that is along the posterior wall of the middle ear, and then it is going to come here down, and to the exterior it comes out through the stylomastoid foramen, you know that. And on the promontory you can see some plexus, that is called tympanic plexus, from which we can see the lesser petrosal nerve which is coming out onto the tegmen tympani. This bone is called tegmen tympani. And coming to the explanations, the roof, bony plate, it separates from the middle ear, separates the middle ear from the middle cranial fossa, and the bone is called tegmen tympani. It is formed from the petrous part of the temporal bone. Floor, if you see, this is the diagrammatic picturization of the middle ear. We have opened up the six-sided box, and you can see this is the floor, this is the roof, this is the lateral wall, this is the medial wall, this is the posterior wall, this is the anterior wall, like that. And floor is formed by a bone which separate it from this structure. This is the bulb of the jugular vein, otherwise called jugular bulb. Sometimes there will be no bone, only fibrous tissue will be there between the vein and the middle ear. Lateral wall is formed by the tympanic membrane, and you see the previous diagram here. The tympanic membrane lateral wall, you can see some area here and also here, a small area, and this part above the tympanum is called the epitympanum, and the part down is called the hypotympanum. So an area there is always towards the tympanic membrane, above and below. Coming to the tympanic membrane is oval in shape, and it has got a tense portion, pars tensa and pars flaccida, this here. And here is the handle of the malleus attached, and most prominent part of the tympanic membrane is called umbo. Most prominent. The tympanic membrane was bulging towards the interior. You might see this one again. You can see the tympanic membrane bulging towards the inner aspect. This is the outer aspect, and here is the tip of the handle of the malleus is attached, and that portion is called the umbo. And the periphery is attached to a bony sulcus. Okay, and from the handle of the malleus you can see two folds of the mucosa going downwards. Okay, and these are called anterior and posterior malleolar folds. Okay, and structure wise, if you see, the tympanic membrane has got 3 layers. Towards the exterior, it has got outer cuticular layer, almost like skin, and it has got a middle fibrous layer and inner mucous layer, just like the respiratory epithelium, pseudostratified, ciliated, columnar. All these 3 layers are developed from the 3 germ layers. If you see, this is from the ectoderm, this is from the mesoderm, and this is from the endoderm. The choroid tympanic nerve, which I have already told you, it is passing between the handle of the malleus and the tympanic membrane. If you put a cone of light, see, if you put light into the ear, you can see a small area where it is lighter in color. That is the area called, that is normally seen. In a normal tympanic membrane, you will always see this cone of light. And the function of the tympanic membrane is to transmit the impulses through the ossicles into the middle ear. Coming to the anterior wall, the anterior wall is, it has got 2 parts. One is the lower part, middle part, and the lower part consists of a thin plate of bone. You can see here, this is the thin plate of bone here. This is the anterior wall, and you can see the internal carotid artery there. Okay, and above that you can see a small area where the opening of the eustachian tubers are. So the anterior wall mainly has got a relation with the internal carotid artery, and in the middle area we have the opening of the eustachian. Above that you can see a small bony process. Okay, this is the bony process. Inside that there is a cavity from which the tensor tympani muscle is passing or taking origin. So that is the anterior wall. Coming to the medial wall, it separates the middle ear from the internal ear, which I already told you, and this elevation is called the promontory. And the promontory is produced by the last turn of the cochlea, and there is a tympanic plexus, nerve plexus on it. The medial wall has got another speciality, which is called the oval window, which is sealed by the foot plate of the steps. The size varies between about 3.25 millimeter to 1.75 millimeter. And here there is one more window that is called round window. It is sealed by a membrane, and it is usually not seen because it is obscured by the overhanging edge of the promontory. So the medial wall has got a promontory with the plexus of nerves, then it has got the oval window sealed by the foot plate, and then we have a round window sealed by membrane. This is the 2 bony projections, which just you remember, ponticulus and subiculum, not very much needed for you. And there is a facial canal, see the medial wall, through which the facial nerve is passing onto the posterior wall, that is, and then which I have told you of the processes, cochleariformis, which is a hook. Here I'll show you, this is the hook which is extending onto the medial wall, where is hooked by the tensor tympani muscle. The posterior wall, if you see, this is the posterior wall. Okay, this is the posterior wall. Main feature is the opening here, that is called the adductus to antrum, and just below here somewhere there is a small fossa which is called fossa ingutis. That is the fossa which is where the small process or short process of the incus is occupying. And there you can see one more elevation. This is called pyramid. Pyramid is this hollow elevation of bone, the inside of which we have the stapedius muscle taking origin. So this is the pyramid, and the stapedius muscle is supplied by a nerve from the facial nerve. Say this is a nerve to stapedius which is going into the pyramid where the stapedius muscle is there. And just below again you can see the caudate tympanic nerve taking origin from the facial nerve. So to repeat, we have the adductus tuandrum here. Here we have a fossa which is called fossa ingutis for the short process of incus. Then we have pyramid. Then we have the caudate tympanic nerve. This is not printed for you. The tympanic cavity is again divided into three parts. You can do the attic portion. This is the attic portion above the ossicles. This is the mesotympanum where it is opposite the tympanic membrane, and this is the hypotympanum. Epitympanum is above this is a medial cavity above the level of the anterior and posterior malleolar folds. Okay, here is the anterior malleolar and posterior malleolar will be here, almost this level. Okay, like this, which contains the head of the malleus, body of the incus, and some ligaments which are connecting. You can see the head of the ligament, head of the malleus, and the body of the incus being attached to the roof of the middle ear. And there is a small space here. This is called Prusak space between the tympanic membrane and the neck here. Tympanic membrane, neck of the malleus, where is the site of cholestatoma, that is a solid material which is formed by recurrent or chronic infection in the middle ear, which is called otitis media. Coming to the contents of the middle ear, we have three ossicles which I have already told you. Then we have two muscles, the tensor tympani, the stapedius muscle. Then we have nerves and vessels. The features of the malleus, which I have already told you, it has got head, neck, the handle, and it has got two processes, lateral process and anterior process, and the head is suspended by a ligament which I have told you, and this is the part which is near the, it is attached to the tympanic membrane, this entire area, and it has got an anterior ligament which is attached here to the anterior process, anterior ligament of the malleus. And you can see this is taken origin from that is the structure which is developed from the Meckel's cartilage. The incus, I have told you the parts, that it has got body, it has got a short process, it has got a long process. Long process is the one which is going to articulate with the stapes. And this is the stapes. It has got head, neck, two crus, anterior crus and posterior crus, and the foot plate which is going to seal the oval window. Muscles, it has got two muscles, tensor tympani muscle. You can see the tensor tympani taking origin from the process, the canal above the auditory tube. This is the auditory tube, and here is the canal, and from which it is going to the malleus, and this will tense the tympanic membrane when there is high pitched sound to prevent barotrauma. Barotrauma means excessive sound leading to injury to the middle ear. Stapedius muscle, I have already told you, taking origin from pyramid. It is attached to the neck of the stapes, and it is supplied by facial nerve. That is also one which is going to prevent excessive movements of the stapes to prevent dislocation. The nerves are the facial nerve, which I have already told you, going from the internal ear roof, then to the posterior wall of the middle ear. Then caudate tympanic nerve taking origin from the facial nerve, the tympanic plexus which is formed on the promontory, derived from the tympanic branch of the glossopharyngeal nerve, otherwise called Jacobson's nerve. Then the sympathetic plexus which is derived from the internal carotid artery. Then we have greater petrosal nerve which is arising from the facial nerve, lesser petrosal nerve you can see arising in the tympanic plexus, and now to stapedius. Then we have behind the middle ear we have two things. One is the mastoid process. Inside that we have the mastoid antrum with the air cells. I'm not going into the details of it. And this you should remember, the McEwen's triangle, which is a landmark which is got relation to the mastoid process in its deeper aspect. and it is bounded by the suprameatal crust. This is a suprameatal crust, a tangential line along the posterior wall of the middle ear, and the posterior margin, see like this. This is the posterior margin of the external meatus, and this is the relation. Mastoidandrum is related to the depth of it. Coming to the applied importance of the middle ear, there can be two types of infections in the middle ear. One is called acute, which is about less than 3 weeks of duration infection inside, or chronic, which is more than 3 weeks. And after the infection in the middle ear, you can see the tympanic membrane can rupture and the pus comes out through this hole which is there in the tympanic membrane, and commonly seen in children because the middle ear infections are common in children, and I'll tell you that later when I talk about the eustachian tube. And there is a condition which is called autosclerosis, where the footplate of the stapes is get ankylosed to the oval window. Then there will be reduction in the movements of the stapes, leading to deafness. So that is the class about middle ear. You are supposed to know about, just to revise, you are supposed to know about what is middle ear, what are the boundaries, roof, floor, anterior wall, posterior wall, medial wall, lateral wall. You are supposed to know about the tympanic membrane, the contents. When you know, you should know about the ossicles, the muscles, nerves and vessels. Then you are supposed to know about the description of each ossicles. Then you are supposed to know about the applied aspects. So please write down the questions you are supposed to know at the end of the class. First question is, structure related to the floor of the middle ear. Second question, what is the nerve related to the posterior wall of the middle ear? Name the nerves present inside the middle ear. Name the parts of the stapes. So make sure you go through the slide again and again, and then answer the questions. Thank you.